For today, we're talking about pause and effect, why your brain will thank you for being more mindful. Like I mentioned, we have Dr. Anastacia Nichols here with us. Her presentation today is going to be on exploring how regularly taking time to slow down and tune into the present moment can have a positive, persistent effect on your brain and emotional well-being. She's going to talk about mindfulness and how it can boost your focus, improve your mood, and support your overall cognitive health. So I want to welcome you, Dr. Anastacia Nichols. She is joining us from the Division of Neuropsychology at Emory Rehabilitation Hospital. She's an assistant professor and also works for the Emory Healthcare Veterans Program through the Brain Health Center. She received her doctorate in clinical psychology with a concentration in...
So pause and effect, why your brain hopefully will thank you for being more mindful. And let's see if my cursor will, there we go. All right, so today we're going to talk about mindfulness. And let me also change my view so that I can see some things a little bit better. Oh, I will just leave that as is, and I'm not going to worry about it too much. All right, so we'll talk about what mindfulness is, and then we'll talk about what the effects of mindfulness are on three broad realms of functioning, including emotional functioning, physical functioning, and cognitive functioning. And then we'll talk a little bit more broadly about mindfulness in practice. And then we'll do a little bit of reflection. Before we get started, though, I want to take just a brief moment to pause and check in with everyone and have each of you check in with yourselves. And I want to do this by having each of you think through how you're feeling about each of these three areas of functioning right now, in this specific moment. So I want you to rate on a scale of 1 to 10, with 1 being the lowest or worst you've ever felt, and 10 being the best or highest you've ever felt. You don't have to share these out loud, and you don't have to put them in the chat, but maybe write them down or take a mental note of the color for each of these ratings that you'll give yourself. And we'll check in and reflect on these ratings later on, so stay tuned for that. So just take a second, as I said, to rate your overall mood or stress level on a scale of 1 to 10, how you're feeling right now, your overall level of physical tension or fatigue, or just how you're feeling physically right now in this moment. And then your overall feeling of alertness or attentiveness right now in this moment. Again, you can think of this as the number scale or the colors that are represented here. Just jot those down or kind of keep those in mind for now. All right, so now that we've done that, let's talk about mindfulness. And for those of you who've heard the term mindfulness, but maybe don't know a whole lot about what it is, it might conjure up some images like some of these. But does it ever make you think about any of these? Surely it doesn't make you think about any of these things. What if I told you that all of those activities, every single one of those pictures from each of those slides, if done under the right conditions, could actually represent mindfulness? So let's talk about how and why that could be. In order to do that, we have to talk about what mindfulness actually is. And I've pulled together a few definitions of mindfulness. And as you can imagine, there are a lot of them. And I, of course, won't go through all of them. The definitions that I've pulled together come from particularly a type of therapy called ACT, or acceptance and commitment therapy. And that's mostly because it's a type of therapy that I like a lot, but there are definitions of mindfulness that span different therapies, that span different religions and different practices and things. And a lot of them share some commonalities. Again, the reason that I chose these ones in particular, just because I happen to like this particular therapeutic model, and not really for a whole lot of other reasons aside from that. But let's take a look at what some of them are. The first one is willing and direct contact with the present moment without getting caught up in the content of thoughts, but being a conscious observer of the experience. Ugh. That's kind of a mouthful. It's a little bit abstract, a little bit esoteric, if you will. So kind of hard to wrap your head around a little bit. So let's make it a little bit more basic, Dr. Nichols. Okay. How about the process of attending to the present in a non-reactive, accepting way? It's a little bit better, a little bit easier to grasp. All right, what's Wikipedia got to say? Practice of purposely bringing one's attention to one's mental processes occurring in the present moment without judgment. Okay, a little bit more straightforward. But what I do notice here are some, again, commonalities between these. So all of them say something about the present or the present moment. So we're getting somewhere here. They also all mention something about attention or observation or attending to something. They also all mention something about being non-judgmental or not getting caught up or reacting, accepting what's going on. And then finally, they all mention this being a process or a practice or being willing to come into contact with this and being directive about this. So again, we're seeing these commonalities even among these different definitions. So if I were to kind of pull all this together and come up with my own kind of layman's term definition for what I would say mindfulness is, I would say in fairly simple terms, mindfulness is just the intentional practice of focusing your undivided attention on whatever it is that you're doing, feeling, and thinking right here, right now, without judging how you're doing it, how you're feeling about it, or what you're thinking. That's all it is. And when you kind of take that together, that makes a little bit more sense than maybe some of those other definitions that we were just looking at. If we break it down even further, make it even more basic, we can maybe explain this in one-word terms. So you can think about mindfulness as being intentionality as opposed to haphazardness, or unitasking as opposed to multitasking, present-mindedness as opposed to absent-mindedness, carefulness as opposed to carelessness, and all of those things, importantly, as being a practice, or practicing these things without judgment, even when, not if, we lose focus or become distracted from the task at hand. Because after all, we are humans with brains, and humans with brains do become distracted from time to time. That's natural. Okay? So we'll talk more about what mindfulness might look and feel like in more specific and structured practice later on. And if I'm mindful of my time, see what I did there? We should have the chance to actually try out some of these exercises together. But first, I want to tell you about why you should even care about mindfulness at all. And to give you just a little bit more context, it'll be helpful to know that mindfulness does have some roots in mental health, or some context about, some of this research that I'll talk about. So mindful meditation itself is really grounded in some Buddhist traditions. And since then, it has really been adapted in a lot of ways to mental health practices. And there have been a lot of mindfulness-based interventions, or what I'll kind of refer to a few times as MBIs, or mindfulness-based interventions, that have been used a lot in psychology. And this is not an exhaustive list. These are just some of the interventions that have been developed over many years, really since about the late 70s or so. And some of them are things like mindfulness-based stress reduction, mindfulness-based cognitive therapy, mindfulness-based relapse prevention, and so on and so forth. There have been a lot of these. Some other evidence-based therapies that really emphasize the use of mindfulness or mindfulness-based practices as a part of their core treatments or core principles are things like ACT that I referred to earlier, and DBT, or dialectical behavioral therapy. So based on the definitions that I talked about earlier, the one-word terms that I mentioned earlier, you really can think about mindfulness as not so much a specific thing, but really a way of being, or a process, or a way of engaging in activities. It's kind of a way of doing things. And when you think about it that way, it makes sense that you can apply it to just about any activity that you engage in. And I like that a lot because that makes it something that in some ways can be really easy to incorporate into your day-to-day life. It's not like something that's necessarily extra you do. It's just a different, maybe, way of doing things than you perhaps have done before. Okay? So before we talk again about the specifics of doing that, let's talk about what some of the benefits or effects are in these different areas of your functioning. So first, the effects of mindfulness on your emotional functioning. We'll talk about your emotional functioning broadly, and then some specific areas of emotional functioning. So one of the really fantastic effects, I think, of mindfulness are on your overall management of your emotions. And I think a lot of times people think of our ability to control our emotions as being a little bit of a light switch, being able to turn them on or off. And emotions just don't work that way. But one of the really lovely things about mindfulness that we see in research is that people who engage in mindfulness practices are better able to, rather than turning on a switch to control their emotions, they're better able to regulate their emotions. And I think of this as almost having a dial to be able to turn things up or down, have a little bit more nuance to their emotions. So research shows that regular mindful practice allows people to regulate their emotions a little bit better. They're able to be less emotionally reactive, even in the face of negative situations. They have a faster recovery from negative experiences than other people. People who practice regular mindfulness are less stuck on negative thoughts. They're able to shift away from those negative experiences or negative thoughts more readily and more easily than they were before, or than other people are. And there's a reduction in depressed mood and depressed symptoms. Regularly engaging in mindfulness and having mindfulness training is associated with more resilience and more stability, even in the face of emotional fatigue. It's also associated with increased self-awareness and increased emotional intelligence. Getting more specific into different areas of emotional functioning, anxiety. Mindfulness has been shown to be similar, actually, comparable to medication for treating anxiety in some people. And it does this by decreasing their levels of worry and rumination. And these are some key symptoms in anxiety disorders. It can serve kind of a dual purpose. So one way is by reducing unhelpful or unhealthy coping strategies, things like trying to push your emotions down or away, or the opposite, getting so stuck on intrusive thoughts, that you can't think about anything else. So basically, being intentionally focused on the present moment can help people from being simultaneously too heavily worried on what's to come in the future and too stuck in their past missteps, right? Another way that mindfulness helps affect anxiety is by increasing positive, helpful, or healthy coping strategies. And some of those include mindfulness or meditative practices themselves. These strategies can have all the effects that I just talked about on the last slide. So things like improving your overall management of emotions, helping you regulate your response to and recovery from those negative situations. But it also helps people become more aware of and comfortable with their thoughts and feelings, even those not so pleasant ones. So people are able to accept the emotions that they're experiencing, even if they don't want to be experiencing them. Mindfulness has also been shown to result in physical changes in the brain that relate to improved attentional control. And I'll talk more about some of those physical changes after a bit. And those changes and that improvement in attentional control can actually allow people to purposefully disengage or pull away from some of those more anxiety-provoking thoughts or ruminations more effectively. And that can also have an impact on anxiety and reduce some of those feelings of anxiousness or anxiety. All right, distress tolerance. So you can think about distress tolerance as similar to having patience or frustration tolerance. So essentially a person's ability to tolerate a difficult situation without having a meltdown, becoming agitated, or becoming aggressive. So why do we even care about distress tolerance? Well, in MCI, distress tolerance can change. And it's not necessarily because the person's underlying ability to manage their emotions has changed, although that can sometimes happen too in MCI. But more often it's because the person's cognitive capacity has changed. That's what MCI means. And that means that things that used to be really easy or even automatic for somebody might now require a lot more time, thought, and effort than it ever did before. And that, in addition to somebody's emotional reaction to that reality, can be really distressing and it can be really frustrating. Enter mindfulness. So mindfulness has been shown to increase distress tolerance by promoting acceptance, decreasing avoidance of those discomforting feelings. So it kind of goes back to what I was saying in the last slide here. Even if it is an uncomfortable or unpleasant experience, engaging in mindfulness teaches us to be more tolerant of that distressing experience and teaches us to be able to disengage rather than getting stuck on that unpleasant or discomforting feeling and just kind of pull away from it, okay? We've also found that mindfulness training reduces the perception of stress. It doesn't take away the stress, it doesn't take away that experience, but it helps us perceive that stress a little bit less. And they've actually found that the most benefit is derived from people who actually had the lowest levels of baseline tolerance. So people who at the beginning of the study, before they ever got mindfulness training, who had the lowest levels of tolerance or the poorest frustration tolerance at the beginning, benefited the most from the mindfulness training. Mindfulness training improves mood and resilience. And folks who, after having this training, showed less depression, less symptoms of anger, fatigue, and confusion. An improved distress tolerance might actually partially explain some of the improvements that we see in mental health conditions like anxiety, depression, things like this, after treatment in mindfulness-based interventions. And a part of the reason that we think this is because when we look at people's improvement over time, distress tolerance is often what precedes improvements in depression or other symptoms of mental health conditions. So we see that people are improving in their ability to tolerate distress before they have improvements in some of these other emotional functioning symptoms. Speaking of depression or mood, the effects of mindfulness on mood are also largely positive. So when we look at the impact of mindfulness-based interventions, in particular mindfulness-based stress reduction practices, we see decreased stress, decreased overall mood problems, reduced symptoms of depression, and reduced symptoms of just general psychological conditions. People report higher levels of life satisfaction, more vitality, increased well-being, increased self-esteem. There's enhanced cognitive flexibility, which we'll talk about in another slide. We also see changes in brain regions associated with stress and reactivity to stress. We see physical reductions in stress hormones and improved stress response, which leads us into our next effect, which is the effect of mindfulness on physical functioning. So first, let's take a quick look at some of the effects of mindfulness on your general physical functioning. So changes to the body's stress response and physiological markers of stress. So mindfulness training has been found to modulate or make changes to the sympathetic nervous system, or the SNS. And the sympathetic nervous system is responsible for the body's fight or flight response. So it's very heavily involved in that feeling of anxiety. If you've ever had that fight or flight response, or essentially a panic response, you know that it is not a fun experience. It's not enjoyable. But the engaging in mindfulness or mindfulness training can also help to modulate the what's called HPA axis, or hypothalamic pituitary adrenal, which is why we say HPA, because it's a lot faster, axis. And these systems, modulating those systems, I should say, relate to or result in reductions of heart rate and blood pressure, and result in lowering of stress hormones like cortisol. Some other physical effects of mindfulness training are things like improved pain management and benefits for stress-related and other conditions, things like psoriasis, IBS, PTSD, diabetes, and HIV. We've seen improvements in sleep quality, which I will also talk about in another slide or two. Mindfulness training can actually make physical exercise or exertion of the same level of intensity feel less unpleasant. Now, notice I didn't say that it makes it feel pleasant, but it makes it feel less unpleasant, which is really interesting. And part of the reason for this is that folks are more likely to engage in routine physical activity, or excuse me, it's not part of the reason, but an outcome of this is that it makes people more likely to engage in more routine physical activity, which then has downstream effects on your heart, your brain, and your overall health. So again, if you are less averse to physical activity of the same intensity, then you're more likely to engage in these activities more regularly. It's going to have these impacts on your overall health. You have all probably heard if it's good for your heart, it's good for your brain, and vice versa. Okay. These effects overall are thought to be due to a couple of different mechanisms or a couple of different reasons. One of those is that mindfulness promotes physical states of relaxation and recovery. Okay, so that's going to be good for your overall stress levels. Another is that there are physical and neurophysiological changes in the way that the brain activates and connects or communicates between different brain regions that are responsible for regulating stress and reactions to stress, which include physical forms of stress. And we'll talk more about the neurological effects of mindfulness in just a bit. Before that, though, let's talk more specifically about cardiovascular health and the cardiovascular effects from mindfulness and mindfulness training. So, as a reminder, MBSR, or mindfulness-based stress reduction, that's what this particular study was about. Some individuals with coronary artery disease did an 8-week course or an 8-week intervention of mindfulness-based stress reduction, and it had real physical impacts on their cardiac functioning. It led to reductions in systolic and diastolic blood pressure, and it improved their left ventricular ejection fraction. If any of you have coronary artery disease, you know that's a really important factor in your cardiovascular functioning, and it's something that they monitor very closely. So just engaging in this mindfulness training or these mindfulness interventions can have these very real physical impacts. Mindfulness training can lower your resting heart rate and improve heart rate variability. And these are indicators of improved autonomic nervous system regulation. Mindfulness-based interventions can actually reduce other cardiovascular risk factors, things like smoking, depression, A1C levels, I almost said stroke, can reduce stroke as well, but stress more broadly can reduce markers of inflammation. And then to the point that I was just making, it might lower the risk of death, heart attack, and stroke. The jury's still a little bit out on that, but there is some good evidence to that. And these are more indirect pathways. So it's through reducing things that are higher risk factors for cardiovascular conditions and poor health outcomes. All right, sleep, as I said, is another factor that's really heavily impacted by mindfulness practices. So engaging in mindfulness can reduce someone's rumination. So that's that getting caught up in worrisome thoughts, caught up in intrusive thoughts or mind racing, things like this, and emotional reactivity. And those, of course, can contribute to poor sleep. Mindfulness can elicit relaxation, which I talked about earlier. And that, of course, can promote restful sleep. Engaging in mindfulness practices can decrease insomnia, fatigue, and depression. It can improve sleep quality, and this is not just subjectively, but actually in outcome studies where mindfulness-based practices have been compared to just general health education or placebo interventions. We find that mindfulness-based practices actually work better than both of those. Trait mindfulness, so not training in mindfulness, but people who naturally engage in more mindfulness-based practices or tend to just have that as a part of their own traits are actually associated with lower negative emotions, and that predicts better sleep quality. So that one's a little different if you don't already have that, but it does lead to maybe some promising thoughts about if people who have this trait have these outcomes, then perhaps we can train this in other people. Mindfulness-based stress reduction training lowers cognitive arousal, which enhances sleep quality. And then mindfulness-based treatments for insomnia, which is another treatment that I didn't mention earlier, but does exist, is showing good evidence for improved sleep onset, improved sleep duration, and improved sleep quality, particularly in older adults, which, as we know, start to show difficulties in sleep as we get older. So all promising information. Right, neurological functioning. So there are changes that we see physically, cardiovascularly, as I mentioned earlier, but also to your brain. And this is really interesting because the changes that we see from mindfulness-based practices, whether that's mindful meditation or mindfulness-based interventions like some of the therapies that I was mentioning earlier, have related to physical changes to the structure of the brain, but also changes to the way that the brain functions, and particularly changes to the way that the brain communicates within itself. So some of these changes include things like increased gray matter density. And when I talk about the gray matter, I'm talking about when you see pictures, really kind of the pink parts, which in the physical structure of the brain we call gray matter. So the gray matter are the neurons, or the what you can think of as maybe being the squishy parts, the regions or the lobes of the brain. And then when we talk about white matter, you can think of that as being the connecting fibers or the roadways. So I like to think of the networks or white matter tracts. If you hear me talk about those, think of those as being the highways or the infrastructure of the brain. And then the gray matter as being kind of the buildings or the buildings, right? Or the communities of the brain. Okay. So neurologically, what we find is that mindfulness-based interventions or mindful practices result in increased gray matter in regions that are important for things like memory, like the hippocampus. Now, a little caveat to that, an important one, is that this might not be as relevant for older adults. There's still research that needs to be done on that. So it's less clear on how this works for older adults, but still an important area to be researched and explored. We also see that there's enhanced connectivity or communication between different brain regions. So that goes back to those white matter tracts or those roadways that I was talking about. Mindfulness promotes brain plasticity or growth, which is important for learning. And it might actually have protective effects against age-related decline. So that's where this is kind of a counter to this other point that I made. The other thing that we're learning is that it might provide symptom relief or management or improve quality of life for some neurological conditions. So things like multiple sclerosis, Parkinson's, some conditions where we don't yet have a cure, but we know that there are some symptoms that impact people's ability to function to their fullest. Okay, some other effects, neurological effects of mindfulness on the brain. And this gets really into the weeds, so I'll try to be as clear as I can. Generally, think of this picture here. The effects of mindfulness on your brain are that it makes it thicker and juicier, okay? So the effects of mindfulness are to increase activation and thickness in the prefrontal cortex, so right up in the very front. And this is associated with things like executive functioning, self-regulation. So when I say associated with, I don't necessarily mean that these increased activation and thickness means that there's better executive function or self-regulation. What I mean is that these areas are associated with these abilities. So research still needs to be done to confirm whether these increases lead to actually these same outcomes. There's still research to be done there. Mindfulness is related to enhance activation and communication within something called the anterior cingulate cortex. So that's also kind of towards the front of the brain. And that area is related to attentional control and emotional regulation. This makes a lot of sense based on some of the findings that we talked about earlier. It's related to increased volume and communication within an area called the insula. That's important for interoception, which has to do with your recognition and perception of your internal state, and pain modulation. Again, this makes a lot of sense based on what we're asking people to do with mindful practice, paying attention to what's going on within them, both physically and mentally and emotionally. Mindfulness is related to or results in, reduced activity and altered communication within something called the default mode network, which is related to self-referential thinking or rumination. So this is something that we want to be reduced. Right? We don't want to be as ruminative, as stuck on some of these thoughts. Mindfulness is related to or results in improved efficiency, improved communication within something called the salience network. And this is a network that is related to attention and filtering of information. So learning or deciding what is most salient, what should be paid attention to, and maybe what should not be paid attention to as much. And then finally, mindfulness has resulted in enhanced function of what's called the dorsal attention network. And this is important for sustained attention or holding your concentration over long periods of time. So all of this shifts us into then finally cognitive functioning. So just briefly here, what research has shown so far is that the effects of mindfulness on cognitive functioning include things like improved attention and focus, enhanced working memory, which is our ability to hold and manipulate information in mind for short periods of time, improvements in executive functioning, and that's our ability to plan, to problem solve, to inhibit ourselves from things that we don't want to be doing, kind of think it, but don't say it out loud. It increases cognitive flexibility, which is our ability to adapt to new situations or switch between tasks flexibly and easily. It increases our ability to be conscious and deliberate in our responses rather than just reacting to things automatically or without thinking through our decisions really consciously. It decreases repetitive thinking that can negatively impact your cognitive performance, so keeping us stuck on certain thoughts or processes. And it can improve processing speed and reaction time. Again, I have a little caveat here that there are some limitations for older adults. The jury is still out on some of these cognitive improvements for studies that have looked at older adults. And in particular, they're not really sure whether mindfulness has huge implications on memory improvements, in particular for older adults. Some of the reason for this is back to what I said a few slides ago about the hippocampus, the area of the brain really largely important for memory. And I think a part of the reason for that is because of some of the neurodegenerative disorders that we see in older adults. Okay, so mindfulness won't necessarily grow back some of the areas of the brain that may be affected by certain diseases. Now, we do want to think realistically about that. With that said, it doesn't hurt. Okay? So now that we have discussed the emotional, physical, and cognitive effects of mindfulness, I want to talk about some ways that you can actually incorporate specific mindfulness practices into your life with some general and more structured exercises. You know, we're getting close to our time, so I want to try a couple of them before we end. But some of these specific guided practices would be things like guided imagery. And in the slides here, I do have some links. So things like guided imagery. But if you want, you could just go to YouTube and actually just search guided imagery. And a lot of videos will come up for that. There's also guided meditations that you could follow. If you've ever heard of the Calm app, that's a really excellent one. Headspace is another really nice one. They have some free trial versions of those apps, but there are also paid versions of those apps. Some that are general exercises, but that you could do for free completely on your own would be breathing exercises. I want you to always check with your physician, particularly if you have any kind of respiratory conditions that might impact your breathing. So make sure that you'd be okay to do any of those. But an example of that would be box breathing, where you would inhale through your nose for 4 seconds, hold for 4 seconds, exhale through your nose for 4 seconds, or through your mouth, excuse me, for 4 seconds, and then hold for another 4 seconds. So hence the box, and then repeat. And you could do this for several intervals. Okay? Diaphragmatic breathing would be another example. This is where you take slow, deep breaths, really focused on expanding the diaphragm or the belly rather than just breathing shallowly into your chest. And again, for each of these, I have links to different videos of examples of those. And then progressive muscle relaxation, where you go through and tense up different areas of your body, different muscles, and progressively relax those. It gets you very in tune with different areas of your body that you may be tensing without realizing it, and training yourself to relax those. Some more structured exercises that you can do are things like the 5-4-3-2-1 method. And this involves identifying 5 things you see, 4 things you can touch, 3 things you hear, 2 things you smell, 1 thing you can taste. And you can vary the order of this depending on what you have going on, what you have around you, and what you can access. I want you to consider making this a different number of things, particularly if you've had any kind of sensory changes. So if you've had hearing loss, you might want to not necessarily make it, 5 things or 4 things that you could hear, right? That might be a little bit tougher for you. If you've had some changes to your vision where it might be kind of hard for you to see things, you can cut out some of those. Same thing with sense of smell or taste. That might not be something that's as easy for you to do. So you could also make it 4-3-2-1 or 3-2-1. Consider making those changes. Similarly, if you've had a stroke or anything that has impacted your ability to feel or sense things with your hands, you can make changes or adapt it. You can practice your ABCs. So acknowledge how you feel right now. Breathe rhythmically. Choose your next step consciously and with clarity. I particularly like this one for making decisions very deliberately without making a rash decision or haphazardly. The 3-3-3 rule. Look for 3 objects, listen for 3 sounds, move 3 body parts. So you can see where these are kind of structured exercises, but things that you could do anywhere and incorporate into your day that doesn't feel like it's too loose and unstructured to know where to start. A body scan is another example. So systematically and intentionally bringing awareness to each part of your body, noticing different sensations throughout without judgment. This is a nice one for relaxation. It's a nice one for pain management and just noticing different sensations. And then everyday activities. This is one that I really, really like. This is where I say that you really can incorporate mindfulness into whatever you are doing. It really just involves focusing your attention, unitasking, being very presently focused on whatever you're doing, whenever you're doing it. Mindful cooking and eating, really enjoying what you're doing, savoring the fruits of your labor, quite literally. Mindful movement, engaging in things like Tai Chi, yoga, walking. Mindful journaling, so engaging in reflections, gratitudes, or just writing about the events of your day, but thinking back about those things very intentionally. Mindful observation or sensation, listening to music, but doing so very mindfully, really listening to the sounds, listening for the different instruments, listening for the different tones of voice of people singing, making observations of nature, listening to the different sounds as you sit out on your porch. Mindful art and crafting, workmanship, being all invested in what it is you're doing rather than just kind of going through the motions. Mindful gardening or landscaping, whatever those activities are that you're engaging in, being very focused on those tasks. Oops. Right? Some tips for getting started in mindfulness. Start small. You don't have to engage in all of these things every single day. Maybe just start with 1 or 2 of them. Maybe start with the things that you're already doing each day, but be a little bit more intentional and deliberate about doing them. Focus on them in a more present-minded way, and then add to it. You can actually start to see some of these benefits even from very short, brief practices. Be patient with yourself. Give yourself grace. Try not to judge yourself. Minimize distractions. Make it a routine. Try again. You are less likely to see those long-term benefits maintained without engaging in that consistent practice. So very quickly here, let's go ahead and practice maybe one or two of these. So in our last minute or two here, just want you to look around, and I can't see you guys here. I want you to identify 4 things that you can see. Those might be 4 things on your screen. They might be in whatever room you're in. Just 4 things. Be an observer of your environment. 3 things that you can touch. That may be on your own body. That may be your partner sitting right next to you. I want you to really feel and sense what it feels like. Is it something hard or cold? Is it warm to the touch? Is it bumpy? My cup here has an interesting texture. I really want you to be mindful about what that feels like. Okay. 2 things that you hear. Hopefully one of those is my voice. Hopefully I haven't lost you in my rambling. But you might hear something else. I can hear the soft hum of a white noise machine outside my office. There might be some buzzing outside of your door. Maybe there's a bird outside. Maybe one of you in North Carolina is hearing some rain. Maybe there's something else going on. And again, these practices are just to engage you with what's going on. Some of these things that we tend to tune out when we're not paying attention to them. Rather than trying to go into some of the videos, because I don't want to be worried about the sound, just want to take a brief moment, maybe to engage in some deep breathing. So I want us to try some box breathing really quickly. So I'll have each of us try to do that box breathing where we're going to inhale for 4 seconds. So in through the nose, excuse me. And hold for 4 seconds. And then exhale through the mouth. And then hold for 4 seconds. And then breathe in again through the nose for 4 seconds. And then hold. And then release. Hold. And one more time of an inhale. Hold. Release. And hold. All right. Now that we've practiced some of that mindfulness, I want you to take another pause, just reflect on how you're feeling about each of these areas of functioning right now in this moment. I want you to be mindful about how your ratings might have changed, if at all, compared to the beginning of our time together. Hopefully you're not feeling worse, even if you're not noticing immediate changes. I do hope that you'll consider adding mindfulness to your list of healthy habits. I think that your brain and your body will thank you for it.